In this video, we will model ways to decrease fear and anxiety for individuals with intellectual disabilities going to the dentist. We will also look at ways to improve the dental experience. Earlier exposure to the dentist and practicing good oral hygiene is the best way to control fear and anxiety. Poor oral health care can have a negative impact on your overall health.
Find a dentist that's right for you. Make your initial appointment. Let the dentist know any medical concerns and challenges you face when going to the dentist.
Dentistry is very important for everyone in the population. Everyone should be included in dentistry. It's important to have good oral health care because poor oral health can lead to other problems in the body. It has a lot to do with quality of life. You want to be able to eat and enjoy, talking and not have pain in your mouth. And then any inflammation in the mouth can lead to further issues throughout the body. So everyone should have access to that because if not, then they're going to end up suffering, and we don't want to see that happening.
Use a visual schedule. Make sure you have transportation arranged. Prepare your bag. Remember these things as well. Make the appointment for the best time of day for you. Don't plan too much on one day. Have something fun to do after the appointment.
Excitement is very key in dealing with anxiety on a dental appointment. So when you're walking through the dentist's office, everyone's saying good morning to the individual and making them feel at home will be a great way to decrease the anxiety and making them more comfortable.
I get a little bit nervous at the dentist. I like to take with me to the dentist my iPad, my Bible, and my cell phone to have something to do until they call me back.
So we want to call ahead and make sure that we know if we can be able to walk on back or deal with the waiting time. If it's a waiting time, we want to make sure that we have enough space, that we are comfortable, that if we need to get up and go to the restroom or get some water, that's available, and just making sure that everything that we need is pre-packed so we can have it when we're waiting.
I like when dentists have movies and TV to watch. It helps me to relax and feel comfortable. I like when the dentist tell me when the next steps are. I like when the dentist give me positive feedback with my appointment.
Well, if there's a lot of anxiety before even the appointment, we usually just kind of schedule an appointment that's like a meet and greet where we're not actually going into the mouth and we're just kind of learning about the family, learning about the patient, trying to get down to the, what the needs are, what the wants are, what we can do to help them. We can kind of go through a lot of the different options to treating anxiety so we can get those patients in the right place.
You can also use visual aids to help communicate your needs or pain level to the dentist.
After a dental procedure is completed, whether this be a routine dental cleaning or a more invasive procedure such as an extraction, aftercare is incredibly important. It is not uncommon to have a difficult time delineating between discomfort and pain. Discomfort is something that is likely to be experienced with any dental visit. Pain is not a normal part of a dental procedure or a dental visit. Making sure that we are delineating between pain and discomfort and providing supportive interventions to the individual to delineate these is highly important. One of the most prominent dental interventions or procedures that can be used to address this barrier is the tell, show, do model. It's very much what it says. You tell someone, you show someone, and then you do it.
So we definitely should make toothbrushing an engaging activity. It should be something that's positive and fun. They should be engaged in what type of toothbrush they would like. Ask the dentist if they have any recommendations. Should it be an electric toothbrush? Flavor of toothpaste and floss is important. It's a trial and error process. Just try different things, find out what works best for them.
Daily care does help with dental care and dental hygiene. making sure that you're using your toothbrush and your floss. That will help with not having to deal with major concerns when you go to the dentist.
So unmet dental health care needs often significantly impact the life of individuals with disabilities. We want to increase their quality of life. We want to make sure that people with disabilities get the same health care as anybody else. So we want to make sure that if we can do anything to reduce that fear and anxiety related to dental health care avoidance, we can, because that's going to directly impact the quality of life. And we want folks to smile big and bright, whether it's everyday interactions out in the community and at their jobs. We want them to feel good about themselves. We want them to have a positive outlook. And we want them to be engaged in society like anybody else. So one of the first things that people recognize when they see you or I is our smile, our face, and we want to make sure that that's shining bright and through.